I've really never taken medication in my life. Even like if I get a headache, I don't take medication. I'm not the type of person. I probably haven't taken a pill in like really in years.
And for me, I'm not opposed to medicine. I'm actually really good at it. But it's never the first and the only thing I think about.
I've really never taken medication in my life. Even like if I get a headache, I don't take medication. I'm not the type of person. I probably haven't taken a pill in like really in years. The only time I've taken medication is if I have a severe infection of sorts. So like there was this one time where like my foot was going green and I'd stood on some glass, whatever, and it was really getting out of control. I'm talking like a 2-inch purple thing growing on my foot. And I thought, okay, instead of getting my leg cut off, I'll take this medication the doctor's given me. Otherwise, I just do not take it. So I will rather go through severe pain than take medication because I believe that my body can fix things. So when I think about taking ADD medication or ADHD medication, I don't really know the difference. I go, well, if I'm messy or if my handwriting's bad or whatever it might be, then that's just who I am. And that's okay. I can get better at it. I can be more organized. But why do I want to take medication?
Well, I'm not gonna be the one to sell you on medication. But what I would say is, so a lot of times people ask me the side effects of medication. Mm-hmm. And for stimulants, for ADD, it could be it decreases your appetite or it can negatively affect your sleep. But you always have to ask the second question, which is what are the side effects of not taking the medicine? What's the impact on your life, on your business, on your money, on your relationships, on your health? Because living with untreated ADD, for many people, and maybe not you, but for many people, it goes with chronic stress because of the negative things that tend to go along with it.
The dysfunction.
And for you, you're clearly not broken. But are you optimized? Do you have full access to your own brain? And I would argue no, and we can do better. But we can do it in steps. And ultimately, I see my job is giving people options and then telling them the pros and cons of each option and then letting them choose, right? I mean, that's what good doctors should do. It's called informed consent. And, I can just tell you my experience. And I told you the story with my daughter, and I've seen that play out thousands of times, that people just become more optimized. And it's not necessarily the medicine, but that medicine, when it's for the right brain, right, the wrong brain, it makes people worse. And if you read my book, Healing ADD, I talk about the Ring of Fire ADD. So ADD and ADHD are different terms for the same thing. 1980, the American Psychiatric Association's DSM, Diagnostic and Statistical Manual of Mental Disorders, I hate that, but it's what we have, was attention deficit disorder, ADD, with or without hyperactivity. 1987, God knows for what reason, they changed the name to ADHD, attention deficit hyperactivity disorder, basically throwing out half the people who had it. Because half the people who have ADD or ADHD are never hyperactive. And they don't get diagnosed because they don't bring enough negative attention to themselves for parents to go, you have a problem and you're giving me a problem. So anyways, different names for the same thing. And if you can manage it by having extra help for the things you're not good at, with exercise, with all of the good habits you have, well, that's awesome. if you want to be 10% more focused, like I treat this writer, and she only takes medicine when she has to get stuff done. But she never takes it when she writes because she has 16 plot lines going on at once in her books. And she goes, no, I think it decreases my creativity a little bit.
Interesting. Because the fact that we're medicating a brain like mine, I go, is that for professional optimization? Because if you just go back like, I don't know, a couple hundred years, if you go back even further to a time when we couldn't like read or write, there wasn't computers and all of these things, you would have had no idea that, you know, if you go back far, you wouldn't have been able to tell an ADHD, well, what I'm trying to say
But you'd be able to tell their life. I mean, I have a patient from Ethiopia, and I'm like, so tell me the impact in your culture. And he said, the people with severe ADHD get excluded because they can't be relied on. And the isolation causes great shame and pain. And they have no idea it's a brain thing.